Hello and welcome to the Mental Health Awareness video series. My name is Dr. Lynette Hillsberg and I am a counsellor. The subject of mental health is rarely discussed. Knowing what can control or change our mental health is important. We need to understand why we feel different and how the choices in our lives can affect our overall mental state. These videos are aimed to help open the conversation to bring awareness of this sensitive topic and encourage people to reach out for support if needed. The information will benefit the deaf, hard of hearing, vision impaired and hearing communities because the information is given in sign, voice and closed captions. As Auslan is my second language and out of respect to the community, I feel it's important that I have a deaf person sign on my behalf while I do voiceover. I would like to introduce James as the interviewer and Trisha as my deaf person who have agreed to help me raise awareness around this sensitive topic. I'd also like to acknowledge the traditional custodians of this land and pay our respects to the elders past, present and future, for they hold the memories, traditions, culture and hopes of Aboriginal Australia.
Hello and welcome. Today we are talking about personalities, and specifically people who have unusual personalities. Often these people are assessed by a doctor or mental health practitioner and diagnosed with a personality disorder. With me today, I have Dr. Lynette Hillsberg, who will explain what this means. Welcome, Lynette, and thanks for chatting.
Thanks, James. It's a pleasure to be here.
So, tell me briefly, what is borderline personality disorder?
When a person has borderline personality disorder or BPD, they find that they may have issues with relationship building, problems with jobs, they're in conflict quite a lot of the time, can be really angry at others and at themselves. The person may have a need for instant gratification. They're in conflict quite a lot of the time, change their mind. They can be really angry at themselves, fighting others. Sometimes they self-harm, they burn themselves, they might eat until they're unwell, and very poor impulse control.
Okay, so what causes borderline personality disorder?
Like with many personality disorders, the causes of BPD aren't fully understood. However, most professionals think it's caused by a combination of things like genes, past abuse or trauma, a dysfunctional family life, or negative or difficult interactions with others during childhood. Keep in mind that not all people who have BPD will experience these things, and at the same time, not all people who have past experience of these things will develop BPD. It's different for everyone.
So what would some of the signs be?
Well, there's quite a list. Frequent mood swings with angry outbursts, poor impulse control, self-harming, talking too much, eating too much, being extremely dependent on other people, a need for instant gratification, like I want it done now, conflict in relationships or difficulty making friends, social isolation with suspicion and mistrust of others, alcohol or substance abuse. People think that your behaviour is unusual. You have problems at work or school.
Well, that's a lot. But it seems that most people would have these behaviours at some time in their life.
Don't get too alarmed if you see some of these personality traits in yourself. A lot of people have different personality quirks. In fact, personality disorders aren't diagnosed until the age of 18 because their personality is still developing. What's different about personality disorders is that the person's behaviour is extreme and they're not able to adapt or change it.
Right. So is it just the one behaviour or can a person have more than one?
Okay, so the behaviours are usually grouped into 3 clusters and they're based on their similarities. So there's cluster A, which is paranoid, schizoid, and schizotypical. So these people appear often odd or eccentric, and they have a pattern of distrust and suspiciousness, can be detached from social relationships, limited range of emotional facial expressions, and acute discomfort in close relationships, distortion in their thinking or perceptions, and eccentric behaviours. Cluster B, antisocial, borderline, histrionic, and narcissistic. And they often appear dramatic, emotional, erratic, have a pattern of excessive emotions or attention seeking, instability with interpersonal relationships, self-image, impulsiveness with their behaviours, and disregard of violation for others. They can be grandiose, need to be admired, and have a lack of empathy. Cluster C is avoidant, dependent, and obsessive compulsive, which is OCD. And these people appear fearful or anxious, socially inhibited, have feelings of inadequacy, overly sensitive to negative judgments. They're submissive or clinging, and excessive need to be taken care of. There's a preoccupation with orderliness, perfectionism, and control.
So, how does a person get diagnosed, or how can we identify this?
Well, there's around 10 different personality types listed in the Diagnostic and Statistical Manual. That's the DSM, which is a manual used by doctors and mental health practitioners, and that's to help diagnose a person. A diagnosed personality means that the person's behaviour is unusual, they're not able to adapt or change it.
So, what happens to the person when they have a personality disorder?
Well, the person has a pattern of experiences and behaviour, deviates strongly from the normal behaviour and expectations of the person's culture. It's common for their behaviour that it's often inflexible. Growing up, starts as a teenager into early adulthood and then becomes stable over time, but it can lead to impairment, and that's dependent on the severity of the behaviour.
Wow, that's a lot to take in. Can you give a couple of examples?
Yeah, it is a lot to take in. If you want more information, you can do research at the different types in the DSM. But the common one is borderline or BPD. And that's where people often demonstrate impulsiveness and risky behaviour.
What do you mean by this?
Well, the person's behaviour is extremely impulsive. They take huge risks, experience considerable distress, have explosive temper and unstable moods. They might feel fine one second, then angry and confused or upset the next. I mean, everyone can sometimes feel this way and have these urges, but people with BPD will find it really hard to stop these urges, and they can be doing things like abusing alcohol, drugs, money, having trouble. They may change their mind about things, about how they feel towards other people around them or about other parts of their life, their sexuality, or how they see things. In some cases, they self-harm as a way of coping with strong feelings or emotions.
Why do they do this?
Well, sometimes it could be a suicide attempt or just acting on urges. Generally, it's a way of expressing emotional pain. The impact in their lives affects not just them, but those around them, and they may have unstable relationships, which is really hard for family and friends to deal with.
Well, that's very interesting. So, is this the main category?
As mentioned before, there are a few other categories. There's also narcissistic personality disorder. And this is where a person believes they're better than anyone else. They're entitled to be given things and often get upset when they don't get what they want.
So, what does the word narcissistic mean?
Narcissism is an excessive interest or admiration of self and physical appearance.
I've noticed a lot of people post selfies. Does this mean they have the disorder?
No, it has nothing to do with taking selfies. With narcissism, it's quite specific. The person is selfish, has a sense of entitlement, lack of empathy, a need for admiration, and easily offended when things don't go their way.
Right. So is there another common one?
Yeah, well, there's obsessive compulsive or OCD, and that's where the person's extremely controlling, preoccupied with perfection, rules, order, and often hoards things. Some of their behaviour could include extreme washing of hands, checking the locks multiple times before leaving the house, feeling unsafe if their routine is interrupted.
What do you mean by this?
Well, it's to do with boundaries.
So what are boundaries?
Okay, boundaries are the physical, comfortable, personal space that we have around us. This is dependent on how you've been raised. So when you travel, say, on a train, it can be really crowded and strangers sitting next to you invading your personal space, which makes you feel uncomfortable.
So how does this affect the person?
We also have emotional boundaries as well. If a person grows up and feels emotionally unsafe in their environment because of, say, family arguments, or they're exposed to domestic violence, because of this, they create their own personal boundaries to make themselves feel safe, which could be starting a routine like counting numbers, washing hands, anything that makes them feel in control of their environment. When that person's taken out of their familiar environment, it makes them feel unsafe and vulnerable. Extreme example of this is when a young person is yelled at by their parents for not keeping their room clean. They see their parents arguing, the parents get a divorce, the child believes it's their fault because they couldn't keep the room clean. And because of this, they believe bad things will happen if they have a messy room, so become obsessed about cleaning. So the child grows up, moves out of home, gets married and is still obsessed about cleaning because of what happened with their parents. So believe that something bad will happen in their relationship if they have a messy house.
Wow. I'm a neat person, so does that mean this happens to me?
No, you can be someone who likes a clean house, but most people know you don't divorce because the house is untidy. This is an extreme example.
So do people know if they have a personality disorder?
That's a great question. People with personality disorders don't always recognise this because of their way of thinking and behaviour. It's just so natural to them. They're very difficult or quite manipulative to have their needs met, and very good at twisting words meaning to suit the situation, and they often blame other people for the challenges they face today in life.
What can you do to help the person?
If you feel the person has a personality disorder, encourage them to visit the GP for diagnosing and managing this. A GP and person will work together to develop a treatment plan. It specialises support or take medication. That's in some circumstances. Once they've been diagnosed, it's helpful they get support from family, friends and community groups.
So what sort of treatments are available?
Well, there is a few. The first thing is to establish a diagnosis and a mental health care plan to identify their needs. Then link into psychology or psychiatry for some talk therapy. And that can be interpersonal therapy where people learn more effective ways of relating to others. There's dialectical behavioural therapy, or DBT. And that's where they learn how to manage their emotions and appropriate ways to respond to people and situations. The professionals who offer this therapy are usually psychiatrists, psychologists, social workers or mental health nurses, and they've got specific training in this. They offer services that can include emergency treatment for people who may be at immediate risk.
What do you mean by immediate risk? That sounds dangerous.
Sometimes a person's thought patterns can become just too intense. And they have thoughts to hurt themselves or others and feel unable to keep themselves safe. And it's important that the person and family are aware of services that can help them when this happens. Often, having the person identify triggers that cause these thoughts patterns are helpful, so they seek help before they get to the point of needing help.
Where can they or their family go for immediate help?
They can call emergency services, ambulance, Lifeline, Beyond Blue, their local mental health service. There's also a suicide callback service available where you can chat online.
Well, Lynette, that sounds quite comprehensive. And thank you for sharing this information about personality disorders.
It's my pleasure, James, and I hope this information has helped understanding a bit more about what it's like when you have mental health illness.